My first recommendation is always to go into your healthcare provider, contact your physician for more information. They can go through screening questions for you and help you guide whether or not testing is necessary. If testing is necessary, you can rest assured that if you get tested with your healthcare provider, that you're going to get an accurate and rapid response. The at-home test kits, picking and choosing which one is a little bit kind of challenging to navigate. Your pharmacist might be able to assist with that. There's a couple that state that they're FDA approved and others that don't. And then doing the procedure itself, it appears that most of them have some sort of an instructional video or at least a pamphlet in there. Really important to read that and make sure that you're not missing something, like it needs to be sent in within 4 hours of testing or just have specific processing requirements. So I think it's important to make sure to read through all that fine print before you do the test.